If you're over 60 and you've been told your blood sugar is too high, or even if you're just trying to keep it in a healthy range, this video is for you. Because here's the thing most people don't realize. What you eat at your very next meal can either spike your blood sugar or help bring it down. And by the end of this video, you're going to know exactly which 5 foods research points to as some of the most powerful tools on your plate. Today, we're going through 5 specific, real foods, things you can find at any grocery store, that studies suggest may help support healthy blood sugar levels. We'll talk about what's inside each one, why it works, and the simple ways to start eating more of it. And stick around, because food number 4 surprises almost everyone, and it might already be sitting in your kitchen right now. Before we dive in, a quick but important note. Everything in this video is general health education. It is not a substitute for the advice of your own doctor or dietitian. If you're managing diabetes or pre-diabetes, or if you're on medication for blood sugar, please talk to your healthcare provider before making any significant changes to your diet. We're here to inform and empower you, not to replace that relationship. All right, let's get into it. Food. Number 1 is one you've probably heard before, but not for this reason. We're talking about leafy greens, spinach, kale, Swiss chard, collard greens, and yes, even plain old romaine lettuce counts. Here's why this matters for blood sugar specifically. Leafy greens are extremely low in digestible carbohydrates. And carbohydrates, especially refined ones, are the main driver of blood sugar spikes after a meal. When you fill a good portion of your plate with greens, you're essentially crowding out the foods that would cause your glucose to rise sharply. But there's more to it than just being low carb. Leafy greens are rich in magnesium, a mineral that plays a direct role in how your body uses insulin. Insulin is the hormone that tells your cells to absorb sugar from the blood. Research suggests that many adults with type 2 diabetes have lower magnesium levels, and some studies indicate that adequate magnesium intake is associated with better insulin sensitivity. One practical tip. If you find greens a little bland, try sautéing spinach in a small amount of olive oil with garlic. It transforms completely. And as we'll see in a moment, olive oil itself has some impressive benefits for blood sugar too. Food. Number 2 might surprise you, because a lot of people over 60 have been told to cut back on carbs entirely. And while that can be helpful, it's not the full picture. The food is oats, specifically old-fashioned rolled oats or steel-cut oats, not the instant flavored packets. Here's the key. Oats contain a type of soluble fiber called beta-glucan. And beta-glucan does something remarkable in your digestive system. It forms a thick, gel-like substance that slows down how quickly glucose enters your bloodstream after a meal. Think of it like a speed bump on the highway between your gut and your blood. Instead of a sharp spike in blood sugar, you get a slower, more gradual rise. The research on beta-glucan is genuinely strong. The FDA has even authorized a health claim for oat beta-glucan and reduced risk of heart disease, and multiple studies suggest it also helps moderate blood sugar and insulin response after meals. Now, the key word here is portion. A half cup of dry rolled oats is a reasonable serving. Cook it in water and then top it with something from later on this list, because that combination will work even harder for you. And speaking of combinations, that brings us to food number 3. And this one works in a way that most people genuinely don't expect. Food. Number 3 is technically a condiment, but the research behind it is worth paying attention to. Apple cider vinegar. Now, before you worry, Matut, we're not talking about drinking large amounts straight. That can actually damage your tooth enamel and irritate your esophagus. We're talking about using it as a salad dressing, a marinade, or diluted in a small amount of water with a meal. Here's what's interesting. Acetic acid, which is the active compound in vinegar, appears to slow the digestion of starch. When starch is digested more slowly, glucose is released more gradually into your blood. Several small studies have shown that consuming vinegar with or before a carbohydrate-heavy meal can reduce the post-meal blood sugar spike. One important caution: if you're on insulin or certain diabetes medications, changing how your blood sugar responds after meals is something your doctor should know about. So please, mention it to them. A simple way to use it: mix 1 tablespoon of apple cider vinegar with olive oil, a pinch of salt, and some herbs for a homemade salad dressing. Easy, affordable, and backed by real science. We've covered 3 foods so far, and I hope you're already thinking about which ones you can add this week. But we still have 2 more to go. And I promise you, food number 4 is one that most of our viewers have never connected to blood sugar before. Don't skip it. Food number 4. This one is in most of your kitchen cabinets right now, and you probably had no idea it could help with blood sugar. Cinnamon, yes, the spice. Here's the science behind it. Cinnamon contains compounds, most notably something called cinnamaldehyde, that appear to improve how your cells respond to insulin. Some research suggests it may also slow stomach emptying, which, just like with the oats, leads to a more gradual rise in blood sugar after eating. There have been multiple clinical trials on cinnamon and blood sugar, with mixed but generally promising results. Some studies show a modest reduction in fasting blood sugar with regular cinnamon consumption. Now, an important distinction. There are 2 main types of cinnamon you'll find in stores: Ceylon cinnamon and Cassia cinnamon. Cassia is the most common and cheapest variety, but it contains higher levels of a compound called coumarin, which in very large amounts may affect the liver. Ceylon cinnamon has much lower coumarin levels and is generally considered the safer choice for regular use. You don't need a lot, half a teaspoon a day, stirred into oatmeal, added to a smoothie, or sprinkled on plain yogurt, is what most studies have used. And speaking of yogurt, that connects perfectly to our 5th and final food, which ties the whole list together. Food number 5 might be the most underrated blood sugar food of all, and in the senior health space, it's criminally under-discussed. Legumes. That means beans, black beans, kidney beans, chickpeas, and lentils. Here's why they're so powerful. Legumes have what's called a very low glycemic index. The glycemic index is basically a ranking of how quickly a food raises your blood sugar compared to pure glucose. White bread scores around 70. Lentils, around 30. That's a dramatic difference, because legumes are packed with both soluble fiber and plant-based protein. That combination slows digestion significantly. Your body has to work harder and longer to break them down, which means glucose enters your bloodstream slowly and steadily rather than all at once. There's also emerging research suggesting that regular legume consumption is associated with better long-term blood sugar control. The practical challenge for some older adults is digestibility. If beans cause bloating, try canned beans that have been rinsed thoroughly. Rinsing removes a portion of the gas-producing compounds. Starting with lentils is often easier on the digestive system than larger beans. A simple swap: replace rice or white pasta at 1 meal a week with a lentil-based dish. Even that one change done consistently can add up over time. Now, let's bring it all together. Earlier, I promised you that food number 4 would be something sitting in your kitchen right now, and I hope cinnamon delivered on that. It's one of the most accessible blood sugar supportive foods on this list, and it costs almost nothing. And I promised you 5 foods backed by real research, not hype. So here's your quick recap. First, leafy greens, low in digestible carbs, high in blood sugar, supporting magnesium. Second, old-fashioned oats, beta-glucan fiber that slows glucose absorption. Third, apple cider vinegar, acetic acid that moderates post-meal blood sugar spikes. Fourth, cinnamon, compounds that may improve insulin sensitivity, especially Ceylon cinnamon. And fifth, legumes, low glycemic index, high fiber, high protein, a triple threat for blood sugar. None of these are miracle cures. But together, as part of a balanced, whole food diet, they represent some of the most evidence-supported dietary tools available to you right now. Here's what I'd encourage you to do this week. 4 simple, realistic steps. Pick just one food from this list that you don't currently eat regularly, just one. Decide where it fits in your meals this week and try it. If you're not already monitoring your blood sugar at home and your doctor has recommended it, consider asking about whether a home glucose monitor might be useful for you. Seeing how specific foods affect your own numbers is incredibly empowering. Take this list to your next doctor's appointment and ask your physician or dietitian which of these would make the most sense given your specific health situation and any medications you're on. That conversation matters, and this is important. Do not stop or reduce any blood sugar medication based on anything you've heard today. Dietary changes work alongside your treatment plan, not instead of it. Always keep your healthcare team in the loop. Managing blood sugar after 60 doesn't have to feel overwhelming. You don't have to overhaul everything at once. Sometimes the most powerful thing you can do is add one good food to your plate, and then another, and then another. Small, consistent choices. That's what the research keeps coming back to. If this video helped you, please give it a thumbs up. It genuinely helps other people over 60 find this information when they need it. And if you haven't subscribed yet, we'd love to have you with us. We put out new videos every week focused on exactly this kind of practical, research-backed health information for your stage of life. And if you want to go even deeper, our next video covers the 3 worst breakfast foods for blood sugar after 60 dorgs. And one of them is probably on your table right now. Click it next. We'll see you there. Take care of yourself. You deserve to feel well.